My first experience of a patient's death was as a student nurse. I was working on an oncology and haematology ward, and I looked after this lady, and we built up a lovely rapport. I really got to know her and her husband, and I remember coming on shift one day and after handover going out to see this lady, and instantly knew that things had changed in her condition. I carried on with my shift, and I went over to speak to her, and she wasn't responsive. All of a sudden she turned to me and said, "Call my husband." Instantly I knew why, and I walked off and cried. I called her husband, and I remember I couldn't get an answer on the phone. As I put the phone down, I could just see him walking up the ward, and I went to him and explained how things had deteriorated, and took him to see his wife. And as soon as he'd gone in the room, he held her hand, and she slipped away. That moment, and that is something that will stay with me forever. My first job after that first experience, I decided that I wanted to go into oncology and haematology, and I worked on that ward. I then moved to hospice care, where I'd had a lot of obviously different experiences, and what I learnt there is that every experience is different for every individual. They've got their own ideas of what they want, and it's important to know what that patient and their family wants and what's important to them. And what I learned in the hospice was that kind of going above and beyond your duty of care to ensure that patients really do have the best experience in probably what is the worst of times. I found from my experience as well that when there is a plan in place and the families know that the patients are receiving what it was that they wanted, it really helps with the bereavement process afterwards. They can cope a lot better knowing that their family member got what they wanted and were comfortable.